Hi, hello friends, welcome to World Explorer India. This year on 12 May, we are going to celebrate International Nurses Day. The theme of the year is Nurses, a voice to lead a vision for future healthcare. Hashtags include #voice to lead, #IND 2021. The previous year themes are Nurses, a voice to lead, nursing the world to health, health for all, health is a human right, achieving the sustainable development goals. Definition of nursing according to International Council of Nurses. Nursing encompasses autonomous and collaborative care of individuals of all the ages, family, groups and communities, sick or well and in all settings. Nursing includes promotion of the health, prevention of illness and the care of the ill, disabled and dying people. Advocacy, promotion of safe environment, research, participation in shaping health policy and inpatient and health systems management and education are also key nursing roles. Nurses and healthcare. Nursing is the single largest occupational group in the healthcare. Majority of the nursing workforce is female. World is facing huge shortage of the skilled nurses. Nurses enable the world to achieve quality, accessible and affordable healthcare. Nurses work very close to the patient. Nurses develop own scientific reasoning and evidence-based practices. Nurses can bring positive changes in the healthcare. Nurses serve the community, protect the health and well-being of individuals, communities and nations. Nurses support and empower nursing workforce is the effective solution to the problem of improving the health outcomes. This is according to International Council of Nurses. 1 out of 6 of world nurses are expected to retire in the next 10 years, meaning that 4.7 million new nurses will have to be educated. Many of the nurses are facing burnout. Close to 80% of ICN's NNA, National Nursing Associations, responded that mental health distress from nurses working in COVID-19 response. And because of burnout, many of the nurses are leaving the profession and it is creating acute shortages of nursing workforce all over the world. This is my study which I have done from Symbiosis International University, Pune. My study is to assess the perceived burnout symptoms and coping strategies among critical care nurses in selected hospitals of Pune city with a view to develop information booklet on burnout management. So this research you can find in a peer-reviewed journal JHPOR. Burnout is exhaustion due to chronic job stress. It is characterized by physical and emotional fatigue and sometimes physical illness. Frustration from perceived inability to end the stress and problems associated with powerlessness in one's job contribute to loss of concern for patients or good job performance. Healthcare professionals are especially prone to burnout, particularly those working in highly stressful conditions. COVID-19 infections and deaths among nurses is very high as compared to other healthcare workers. Nurses work for health promotion and preventive health, coordinate care for the patients with the complex multimorbidities in acute and chronic diseases, provide lifestyle counseling, health needs of the marginalized people, contribute to decrease health inequalities, and promote social justice by working in wide variety of settings. Nurses are skilled to care for the patients by individualized plan of care, involve family members in the care, promote mental health of patients as a part apart from caring the physical illness, coordinate with the healthcare team, compassionate caring role by adapting to ever-changing technological needs. Challenges nurses face: shortage of nurses, workplace aggression or workplace violence. It may be ranging from verbal abuse, low wages in private settings, poor image in the social media, television channels and news, lack of political support. Nursing being caring profession, there are low opportunities to practice independently. lack of awareness about the work done by the nurses in public, and lack of application of technology and use of technology in curriculum. Environment is high risk for infections. We need laws supporting the nurse-patient ratios. Nurse-patient ratios are associated with decreased infections among the patients and also improve the patient care and also decrease the mortality rate and will help in retention of the staff, avoid the burnout among the nursing fraternity and also improve the quality of care. So this year on 12 May 2021, the vision is the future of healthcare should be sustainable and fit for the future. If we need a sustainable and fit healthcare, we need support from all the sectors. The future of healthcare should be accessible, safe and affordable. The future of healthcare should be equitable and ethical based. The future of healthcare should be person and community centered. So to achieve all this, there should be independent nurse practitioners to decrease the healthcare cost, and also nurse-led clinics should be initiated all over the world. The future of healthcare should be integrated and holistic. The future of healthcare should be sustainable and fit for the future. An appeal to community: appreciate the work nurses and midwives, community health workers do for your welfare. We work with the life and death. We work in communities, hospitals, organizations and schools. Avoid violence in all forms, in all places, including the social media. The hardest part in nursing is non-nursing personnel are involved in the policy making of nurses, and nurses are not allowed to be the decision makers in all forms of settings, majority form of settings, be it a school or it a hospital or at the national level. We need political support, media support and public support so that nursing can flourish like anything. Without support from each and every other sector, nursing is not a dream for a child to become a nurse. With nursing shortages, there is an increased chance of infections, mortality and decreased quality of healthcare. With nurses, we can decrease the costs associated with healthcare. So advanced nurse practitioner courses and advanced nursing practice, independent nursing practice, nurse entrepreneurship should be encouraged, and technological support should be there for nurses. So there is a need for innovations which assist nurses in their areas of practice. If you like this video, subscribe, like and comment. For tools on burnout and research study, click on the link in description. If we are able to develop the coping strategies, we can decrease the burnout. Thank you.